Cardiovascular disease is going to cost the healthcare system $190 billion between now and the next 5 years. And 50 to 80% of cardiovascular events can be prevented. So there's this massive opportunity for technologies like artificial intelligence and machine learning and NLP and wearables to reduce the impact of cardiovascular and chronic disease. Today I'm in Western Sydney, New South Wales to speak to Professor Clara Chow, Academic Director of the Westmead Applied Research Centre. She's a cardiologist and clinical lead of community-based cardiac services at Westmead Hospital and is also a member of the Western Sydney Local Health District Governing Board. And in this episode we talk about the innovative solutions that WARC is creating using technology to reduce cardiovascular and other chronic diseases, how a cloud-based platform can improve patient outcomes by delivering customised support to patients with chronic diseases in a personalised approach using text messages, and the best approach to leveraging health data from wearables to provide evidence-based health advice. Collaboration starts with a conversation team at Health Tech. Well, let's make it happen.
Welcome to Talking Health Tech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Hey Clara, how you going?
Good.
Good.
How are you?
I'm really good. It's great to be out here in Western Sydney and being able to catch up with you here within Westmead and the Innovation Precinct. I'm going to get you to tell me a little bit about that in a second. But firstly, Can you introduce yourself and who you are, what you do?
Well, I'm Clara Chow. I'm a cardiologist and I'm also Academic Director of the Westmead Applied Research Centre, which is a centre based here in the Westmead Precinct, but is the centre of the University of Sydney. I'm into clinical work, but I'm also a researcher and very much into the prevention of cardiovascular disease.
Got you. Excellent. And so you're here within the Westmead Applied Research Centre. That was handy that it was up there on the thing. Or here at WARC. Tell me a little bit more about what happens within the centre.
So, I mean, we've actually been here for 5 years, though I've obviously been in research and kind of clinical work for longer than that. The goal of our centre is to address the burden of chronic disease. So chronic diseases are like cardiovascular diseases, diabetes, lung disease. There's a lot of chronic diseases. But how we want to address that is with innovation, often using technology to improve how we deliver healthcare to patients and to make it, I suppose, easier for patients to manage their chronic health conditions.
Got you. I feel like that research element is really important though, and having evidence-based solutions, and that's really critical in the healthcare space, because it's one thing for someone who might have come from a clinical background or have their own lived experience, or just a reason to create an intervention or a solution or an app or something within a health space, but you're particularly focused on getting the evidence for it first?
Absolutely. We are a research centre. We are all about evidence. We've run multiple clinical trials and currently probably have got 30 currently running. I mean, while we are excited about technology and its ability to improve and help us deliver healthcare, we want to be convinced that the evidence actually shows us that it improves health outcomes and patient experience, as well as does that, reasonably cost effectively. I mean, we don't want to just add burden to our already burdened health system. We do realise the challenge into the future is that we've got more and more people with chronic health conditions living longer and longer that want to live in the community, and we need to work out ways of supporting them smartly, and technology seems a good thing, but we don't want to use the things that don't work.
And that's really important too. I think that at least I observe that in Australia we're very good at conducting research and doing that upfront piece, but sometimes the motivations or the drivers for doing that might not be totally linked to actually creating a real solution that's going to get out there into the healthcare system and take into consideration all of those different stakeholders and the needs and the sometimes competing requirements. So it's good to have that, I guess, holistic kind of perspective in what's going on. I'd love to hear a little bit more about some of those examples of whether it be interventions or solutions or some of that research and some of the outcomes there that you've done so far.
Sure. Well, I mean, since we're about health tech, I'll talk to you about our digital clinical trials. We started probably in about 2011 with our first digital trial. That was a fairly simple text message-based solution. Our problem as a cardiologist and, I suppose a service delivery leader was a lot of our patients with heart attacks were actually coming back to the hospital with repeat heart attacks. And we were realising that, we were pushing them out so quickly that they weren't able to learn about their condition, understand what they had to change and, understand their treatments. So we developed this text message-based education support program that we delivered to patients after their heart attacks. We evaluated in a randomised trial. That means we gave half of the people, a random half of the people, this text message-based program, and the other half got usual care. And the people that got the text message-based program actually achieved lower cholesterol, lower blood pressure. They were more likely to quit smoking. They were more likely to get a good diet and be physically active 6 months after their heart attack compared to our usual care patients. And we went, wow, this is a really simple solution, relatively speaking. I mean, we did take a lot of time to develop it. We, were very careful with what we put in the messages. We had academics, clinicians, as well as patients help us develop the program. And we also developed a software piece to deliver them such that the messages landed at the right time of the day, in different times, etc. And also personalise the message to individuals. So, obviously smoking is really important for a smoker, but it's not important for a non-smoker. If you're vegetarian, you don't want to receive information about meat. There are simple things, but that can customise programs, and we did customise programs to individuals, and that was what the software did. But we were really excited about the impact. And I suppose onwards from that, we've done, over, probably 15 clinical trials now that have looked at different ways of supporting patients with different chronic health conditions, a little bit of a similar kind of ethos though, simple, customised, personalised and, delivered via digital technologies.
So cool. And I love that it's, I guess the end result from a consumer is a simple text message and there's some simple technology and looking at removing some of the noise, but obviously under the hood, there's, some of those rules and everything that's taken into consideration. And I'm going to guess that there's probably like that first iteration, which is here's the concept of it, but no doubt there's opportunities to build on this particular solution with other technologies as well?
Yeah, absolutely. So, we started with simple text message-based solutions, and actually the user interface still is often text because that's what is simple and also scalable to many people. You don't have to worry about upgrading, updating, whatever, your phones and stuff like that. But yes, the complexity of the software behind it has increased a lot over time. We initially used fairly simple fixed algorithms. Increasingly, we're using more complex algorithms to customise the conversation we have with patients, to put in more data. Our most recent clinical trial, one of our most recent clinical trials called My Cardiac, is actually starting to pull in their wearable data, so data off the wearables we wear around our activity and steps and stuff, but also stuff off like their blood pressure machines that they can have, and that can then also feed into the program, and we can customise our support, provide sort of advice on how to deal with those things. Some people do their blood pressures all the time and they don't know if, it's good or bad if they have 3 or 4 measures that are a little bit up or a little bit down. So we start working out with our algorithms when they should ting the doctor, whether they should go, and we encourage them. And if they don't go, we encourage them more. So it is a very patient-focused thing, but we are increasingly utilising AI. We are utilising wearables, other mobile devices. We're using text, but we're also embedding a lot more videos and other smarts into things. We can connect into, I suppose, apps where they can pull down even more information if they want to give them more options.
Yeah. I'm just thinking as well too, like the particular geographical location that you're in to conduct this research. These are issues that obviously are important across Australia and other parts of the world too. But here in Western Sydney, these points around chronic disease and cardiac issues, as well as these points around creating information and communication that's easy to access for anyone, no matter who they are and their preferred method of communication. So I'm going to guess that being in this particular location has kind of inspired some of that too.
Yeah, look, absolutely. I've always felt lucky to work in Western Sydney and the Westmead precinct. It challenges us as clinicians, where we're delivering services to quite a diverse patient population. I mean, over half of the people living here have other languages as a first language as opposed to English. A lot of people here are from very diverse backgrounds where, money's not easy for many people in the population, but they still need to care about their health because they are the sole breadwinner of their families and things like that. So yes, we've been very conscious of equity in developing our solutions. We want to ensure that we're not just supporting those that are really good at tech. We also have a lot of older people that struggle with not only language but also with all of this new technology. So we constantly consumer testing across a very diverse population. We can do that here in Western Sydney. All of our new offerings, and we are releasing DigiCuris now, which is an exciting, new platform. But, being able to provide all of our programs in multiple languages, customised to the health literacy of individuals. So, health literacy is something about, how much you know about health already versus people that have less the knowledge of health. So they're customised to that type of thing, as well as customise, your cultural and food background. I mean, it's probably not appropriate to tell everybody in Australia to cook on the barbecue, but a lot of us, do and want to learn. But bringing in some of those cultural customisations is important as well.
Yeah, no, absolutely. You mentioned DigiCuris. So is that the taking, the research and what you've learned through developing these solutions, now creating a product out of it?
Yes, we're very excited that we were able to sort of launch our DigiCuris this year, and it is a culmination of a lot of our research learnings over time. It is research driven. It brings in learnings from all of our way back to our text message based, sort of simple and scalable kind of ethos, and learnings we've got from those to the multiple different algorithms we've, I suppose, learnt and developed over time. And it'll be, I suppose, strong enough from a technology sense to deliver these complex and personalised and customised programs to loads of people simultaneously across Australia with lots of different health conditions. So, yeah, we're really excited to be able to start building real product from all of our research, and I suppose that's how we hope to actually create impact for our patients.
Absolutely. I'm going to guess that to have that impact and to use this knowledge and insights, and absolutely I think that being able to do that at scale, you need that solution, a product, a technology that wraps it all up and makes it available to more. But, within healthcare, it's going to require different partnerships and collaborators, and that's what we've talked about for years on the Talking Health Tech podcast. So who are you really keen to connect with, or the types of groups or partners to help take this DigiCuris to the next level?
Sure. Well, look, I mean, we are still a research entity, and, we'd love to partner with other researchers that might want to work on different things. But we are really keen to find an industry level partner that is in the business of delivering things at scale and is aligned with our ethos of supporting many patients with high quality, evidence-based healthcare. That is who we'd like to find to work with. I think that I've watched the digital health space for a while too, and yes, there's lots of different groups in the markets, and we do need to work together, and we're keen on working together, and our solution is integratable to a lot of the different platforms out there. We don't prescribe one way or the highway. There's a lot of learnings we bring into a lot of the programs we've co-designed with various partners in the past. We've already, I suppose, delivered pilot implementation programs, partner with the Heart Foundation. We delivered their My Heart, My Life program across Australia, and we were able to, I suppose, bring a lot of our learnings to it, but also incorporate a lot of the content that the Heart Foundation has developed into the programs. We've also delivered the heart health program out of Westmead Cardiology here in Western Sydney, and again, challenged by the complexity of Western Sydney, that meant that we had to customise the program to the many different, I suppose, patients and people that come in through our doors here.
Well, I mean, I've always thought that Western Sydney in particular is a great example of it's not totally representative, obviously, but it's a good place that I'd encourage more to look at in terms of demonstrating the accessibility or the utility of a particular solution here, because it's an amazing melting pot of cultures and capabilities and interests that is somewhat representative of the broader population. So that's great that you've got that in mind. And so moving, looking at 2024 and beyond, and you've got DigiCuris on the roadmap and launching and everything. What can we look forward to seeing from everything here at WARC, but also with DigiCuris over the next 6, 12, 24?
Yeah, okay. Well, I mean, WARC is still developing lots of other novel solutions. We are evaluating, as I mentioned, MyCardiac, which will be, really focused on this really big problem of hypertension or high blood pressure, which is still the leading cause of cardiovascular disease across Australia and the world. We want to bring to it our technologies in really customising patient support with MyCardiac. So we're hoping to deliver that as a clinical trial this year. We are also hoping to start getting our solutions to more people. As I mentioned, we have been supporting patients in Western Sydney and with cardiovascular disease. But, there's a lot of potential to support patients after, any hospitalisation in Australia. Many people have chronic health conditions, and the opportunity when they touch a hospital system is to prevent them coming back to that hospital again. And, I really would like to see us start addressing that big problem for our health system. I don't think people want to come back to the hospital after they present.
I mean, it's very nice. But yeah, maybe for a tour, but not for any other reason.
It's a dual goal. Patients don't want to come back, and hospitals don't really want them to come back either, because, it's an overburdened system. We really need to get into that space, and I think DigiCuris can help us.
Yeah, absolutely. And I think also being able to build a solution that has the potential to tie into other parts of the broader patient journey too. So, patients going back to their GP or tying into other parts of the healthcare system too, and feeling like the healthcare system is supporting them no matter where they are. So I think they're also going to be really important things too.
Yeah, no, absolutely. We've got a lot of GPs and primary care personnel on our research teams here, and they keep us honest and connected with primary care. I mean, primary care is fundamental in Australia. It always has been, but I think that patients do want to be able to drive their care and want to be empowered, I suppose, to do that. So working out how they connect more effectively with primary care is also something that is an important theme throughout work.
Well, look, Clara, I really appreciate the time that you've spent with me today to take me through a little bit about WARC and DigiCuris and all the great work that's happening here. So we'll put the details in the show notes of this episode for people to check out, and also for those industry partners and other collaborators keen to connect and help take things to the next level as well. So I really appreciate you making the time. Thanks so much.
No worries. Thanks a lot.
Thanks.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.